set? Okay. Good morning, everybody. I want to thank Premier Ford and Deputy Premier Jones for attending Windsor Regional Hospital today. Since this government has been elected, and even after a worldwide pandemic was declared during their first 18 months of office, the Ford government's responsiveness to Windsor-Essex healthcare issues needs to be highlighted. With respect to the new acute care hospital during the first summer of the pandemic, after a meeting with Mayor Dilkens, other Windsor-Essex and Chatham mayors, Premier Ford promised he would make it happen. Happen it did. Not only did the long-awaited monies promised by the previous government for Stage 2 planning arrive, but also a date for construction was confirmed and has since been accelerated under this Premier to 2026. To top it off, we had two legacy capital projects that were also promised over a decade ago, with big fanfare and not delivered upon. One for a second cardiac cath table and the other for a fourth radiation bunker, both desperately needed before we move into the new acute care hospital. Again, this government approved them to proceed last year, but did not make the announcement public until now. Unfortunately, we cannot solve them overnight. Again, all of this is happening in the midst of a pandemic and the worldwide fallout with issues like supply chain and inflation arising from the pandemic. Premier and Deputy Premier, on behalf of Windsor Regional Hospital and our team, thank you for listening and getting things done. I'd like to call upon now Mayor Dilkens. Mayor.
Well, thanks very much, David. And I have no script. And I just want to be here to say, on behalf of this community, thank you to our Premier, thank you to our Deputy Premier and Minister of Health. So long people in Windsor have heard the comment that Ontario stops at London, and probably have parroted that comment at some time in the past. And I think of the announcement that will be made today and how long it took from the time it was announced almost 10 years ago to the time of delivery by this government, what this community has gone through. And for patients who have to go to Detroit to get treatment, that will no longer have to be the case. For patients who had to drive up the 401 to get treatment in London, that will no longer be the case. And so thank you, Premier. Thank you, Deputy Premier. And most importantly, thank you to the staff of Windsor Regional Hospital and the leadership here at Windsor Regional Hospital. You have done amazing things with the equipment and the facilities that you have, facilities most importantly. And you know that this government has accelerated, which makes me, Premier, thank you. I haven't seen you since your government made the decision to even further accelerate the timeline for our next acute care hospital in Windsor and Essex County. That is an important milestone and important for this community and something that we have asked for a long, long time. So the staff, and to the staff who deliver oncology services here in the city of Windsor, thank you for what you do. Better days are ahead. To the staff who deliver catheterization and work in the Heart Lab, thank you for what you do. Better days are ahead. And to everyone who plays a role in delivering excellent health care in Windsor and Essex County, it has not gone unnoticed. It is appreciated. I know the pandemic has been tough on a lot. You've been called upon to serve in incredible ways. And on behalf of this entire community, I thank you. And it gives me great pleasure now to welcome our Deputy Premier, our Minister of Health, Sylvia Jones.
Well, thank you very much, Drew. Mayor Dilkens, for that kind introduction. Good morning, everyone. It is great to be back here in Windsor alongside Premier Ford and with our local colleagues Andrew Dowie and Andrew Liardi. I want to especially thank David and the team here at the Windsor Regional Hospital for your warm welcome earlier today, and to the entire staff at the hospital for all their efforts to provide world-class care for the people of Windsor-Essex. Every day, as Mayor Dilkens said, you go above and beyond to care for patients and support families. And for all your hard work, we thank you. Our government wants to support your efforts to ensure that whenever Ontarians need health care, there will always be highly trained staff there to help them. and that means reducing the barriers that healthcare professionals from other provinces face when they want to work in Ontario. This will make it easier for our hospitals and other healthcare settings to provide the care Ontarians need, especially in urgent and critical situations. I will let Premier Ford share more of this good news. Our government also believes in the importance of being able to connect care closer to home. We know that for some, patients have had to travel to London or Detroit to get cardiac care, or have had to wait to get the cancer treatments they need. So it gives me great pleasure to announce that our government is investing $30 million into the Windsor Regional Hospital to improve facilities for patients with cancer and cardiovascular disease. This funding will make it easier for more patients to be diagnosed and treated right here in Windsor, Essex. This investment will enable the hospital to renovate and expand your cardiac catheterization lab, which currently operates 24 hours a day. This means that the hospital will be able to expand services for cardiac patients in this region. As part of this investment, we are also going to improve access for patients by expanding the hospital's cancer center to accommodate a new linear accelerator, which provides cancer patients with necessary radiation therapy treatment. Windsor Regional Hospital will now have the capacity to treat more cancer patients with life-saving radiation therapy closer to home. Our government has a plan to build a stronger, more convenient and connected healthcare system by investing in our hospitals and healthcare facilities across Ontario so that patients can connect to the high-quality care they have always expected and received whenever they need it, because we can no longer stand by and accept the status quo. The challenges of today require innovation and forward-thinking solutions. And these bold solutions will mean you continue to access health care with your OHIP card, not your credit card. Under Premier Ford, that will never change. We will continue to work with our partners to make it easier, faster, and more convenient for you to connect with care, because your health matters. Thank you. Stay well, and I'm now proud to turn it over to Premier Ford.
Well, thank you, Minister, and well, good morning, everyone. And it's great to be back in Windsor. When I come here, I have just incredible visits with the people and the whole community. So, thank you again, Minister Jones and Mayor Dilkens. I always say Windsor's all-star mayor. He's actually an all-star and a champion combined. And I get in trouble, by the way, Mayor, from all our other buddies that are mayors when I call you the champ, but you are the champ. And a real partner he is, who never stops working for the people he serves. And speaking of all-stars, we're also thrilled to have MPP Dowie and MPP Liardi here with us today. And there's 4 people that make things happen down here. I'm sure there's many others, but I named 3. Now, this is one of my top CEOs. I rank him as right in the group of the top CEOs when it comes to the hospitals. I want to thank David for hosting us. And David's a real champion for healthcare in Windsor, Essex area. I've never seen someone so dedicated to serving his community. It's great to be back at Windsor Regional Hospital. And I talk about David to other people and other communities, how he's an out-of-the-box thinker. He never has to be, David, do this, do that. He's the one calling us up and giving us great ideas and just moving forward because he knows it's the right thing to do. And you really do lead a world-class team here, some of the best anywhere. And we're all so lucky to have you, David. So keep up the great work and your team members as well. Over the past several years, the doctors, nurses, and support staff at Windsor Regional and at hospitals throughout the province have given their all. They've worked tirelessly to take care of us, and we're so grateful for all the work that they do, keeping people and communities safe and healthy. The past several years also taught us, when it comes to your health, the health of all Ontarians, the status quo is no longer acceptable. We need to be bold, we need to be innovative, we need to be creative. We need to look to other provinces and countries to see what they're doing differently and borrow the best ideas. We also need to be clear. Ontarians will never access health care with their OHIP card, never their credit card. Our goal is simple. Whether it's an emergency in the middle of the night or a problem that's been bothering you for years, no matter where you live, we want to connect you to more convenient care closer to home. Together, we've come so far. Since 2018, over 60,000 new nurses and nearly 8,000 new doctors have registered to work in Ontario. In fact, last year was a record-breaking year for new nurses in Ontario, with over 12,000 new nurses registered and ready to work, and another 30,000 nurses studying at a college or university, providing a pipeline of talent and reinforcements. We've broken down barriers so that more internationally educated nurses can put down their roots here and help care for our province. We've added 3,500 hospital beds with another 3,000 more under construction. We're helping 30,000 more seniors find a new long-term care home and helping another 30,000 seniors find an upgraded home. But when it comes to your health, we must do more, and we're doing more. Like I said, as we connect people to more convenient care, we need to be bold, innovative, and creative. Today, we're doing just that. In February, our government will introduce new legislation that, if passed, will allow Canadian healthcare workers that are registered or licensed in another province or territory to practice in Ontario immediately without having to register again. We call these new rules as of right, and Ontario is the first province in Canada to implement them. A doctor from British Columbia or a nurse from Quebec who wants to come and work in Ontario shouldn't face barriers or bureaucratic delays to start providing care. These healthcare workers are highly trained. Other provinces and territories have the same high standards as we have here. So these changes, once implemented, will automatically recognize the credentials of healthcare workers registered in other provinces and territories, so they can get to work as soon as they get here. Ontario's new as-of-right rules are exactly the kind of innovative solutions we need. They're going to bring much-needed reinforcements to the front lines of our healthcare system. So to nurses, doctors, and healthcare workers across Canada, if you've been thinking of making Ontario your new home, now's the time to make that move. We're here, we're waiting with open arms and jobs to fill. Our legislation will also, if passed, make it easier for hospitals and health organizations to increase staffing levels in times of need by allowing nurses, paramedics, and others to work outside of their regular responsibilities or settings, as long as they have the knowledge, skills, and judgment to do so. This kind of flexibility will let hospitals like Windsor Regional fill in-demand roles, fill gaps in care, or to manage periods of high patient needs like a flu surge. Together, these changes will increase the number of healthcare workers in our healthcare system and provide our hospitals with more flexibility to ensure Ontarians are connected to high-quality care when and where they need it. My friends, as I said before, the status quo is not acceptable. A lot of people out there, they want to have endless debates about our healthcare system, but the people of Ontario, they want action. We're being bold, we're being innovative, we're working hand in hand with our healthcare partners. We're making it easier, faster, and more convenient for you to connect to care. Because it's about you, it's about your health. Thank you, and God bless the people of Ontario.
Okay, we'll now take questions. Just a reminder, it's one question, one follow-up.
Good morning, Premier. Michelle Molesky from CTV Windsor. Thank you for taking
Hi,
our questions.
Michelle. Thank you.
My first question is in regards to this training program for getting nurses to work in Ontario. Is your government considering offering this up to nurses who work and practice right now in Michigan?
Not right now, not in the U.S., but I'll pass this over to the minister.
Yeah, it's a great question, and I'm sure it is certainly of interest in Windsor in particular. But at this point, the right to practice will be available and open to all Canadian jurisdictions because we know that there is an equivalent level of expertise and education that is needed regardless of whether you practice in Manitoba or Quebec. And I want to reinforce this is for people who want to practice medicine and be clinicians and healthcare professionals in the province of Ontario. We do not want to put barriers up if you want to live and work and have your family in the province of Ontario. Thank you.
And just to follow up, Premier, as was mentioned, this second table for the cardiac cath lab was promised nearly a decade ago.
Yes.
Without taking too many shots at the Liberal government, what reassurance can you give this community that this time it's for real and that table will open?
Well, I think we have a track record of doing what we say we're going to do. When we promise something, we move on it. We really knock down every barrier to get it done. And, you know, I have to tell you, the people of Windsor were ignored for decades. There was a lot of talk down here, but nothing was getting done. Because, you know, the great leadership right to the left of me, I mentioned 4 people, now there's many more that live in Windsor. They're getting that new hospital. They're getting the investments like we announced today, great investments from LG and Stellantis, making sure that other companies are coming here. We have some future exciting news about creating jobs, but we're building new schools, building bridges and roads and expanding Highway 3. So I don't know of another government that's shown more love to the people of Windsor, and it's been long overdue than what our government has done.
Hi, Mr. Premier. It's
Hi.
Dale from CBC News.
Hi, how you doing?
Hi. I just want to ask you, what do you say to your the detractors to your plan to use private clinics that say that it's going to siphon off nurses, siphon off other staff away from the public system?
Well, the detractors, for the most part, are the ones that created hallway healthcare for many years. They're the ones that refused to build the hospitals, not only here in Windsor, but other locations. You know, we're building either brand new hospitals or additions, 50 locations throughout Ontario. We're putting in excess of $40 billion in there. We're hiring more nurses. We're building universities for students to become a doctor. And we're just really pouring the resources. But do you know what we're doing differently? As the previous government was fighting with the docs, we signed the quickest deal with OMA that I've ever seen in recent memory. We always consult with the CEOs. I'm a strong believer, and I've said it a million times, I'll say it again, I'm not a healthcare expert, but people like David and his team and other healthcare workers around the province, we communicate all the time with them. They're the experts. We take their lead. And changing healthcare in Ontario should never, ever come from a politician. It should come from the frontline healthcare people that deal with the needs of people in Ontario day in and day out. And that's exactly what we're doing. And I'll tell you, I keep pumping up David and the mayor, because it's true. I travel around the province. These two guys are doers. They just make it happen on all fronts. No matter if it was the partnership with the mayor and our local MPPs about getting Stellantis or building this new hospital. I'll tell you, you guys have really incredible representatives down here.
And just on another topic, the City Council just authorized the use of 2 new gas turbines to generate some power at Capital Power, and it needs provincial authorization. Is your government going to be authorizing those to go online to produce electricity?
Well, I haven't had the opportunity to sit down with the Minister of Energy, but we will do that. Sit down with him, have a good discussion, and weigh out the pros and cons like we always do. It's very simple. If any decision we make is not good for the people, don't do it. If it benefits communities and people, and no matter if it's the healthcare or jobs, then we do it. And we go all in on it as well.
Hi, morning with Blackbird News.
Hi.
So we've heard from Dave Boucher about the success of the cataract clinic, moving it off into this private clinic. We've heard from you that people are not going to be using their credit cards at these clinics. Does it cost the province more to offer these services at private clinics than at a public facility? Are you offering these private clinics more than what you are offering hospitals?
Well, that'd probably be best for the minister, but our whole goal is to make sure no one ever pays with their credit card. They pay with their OHIP card. But there's so many endorsements from healthcare professionals and CEOs of hospitals saying, you know, because we're going to be partnering with the hospitals. It's not going to be standalone. We're going to work hand in hand with these independent health facilities. But what it does, it just takes the load off the backs of hospitals to free up time in the operating room. And I use this example, I use it again with my mom when she needed a hip replacement, and any senior, you don't have to be a senior, if you need a knee replacement, hip replacement, cataracts, you know how much pain they go through day in and day out, the discomfort these people live in as they're waiting months and months, you know, to get help. It's unacceptable. We're going to make the change and get the backlog down, and we're going to continue all working together to make that happen. I'll pass it over to the minister.
Yeah, thanks for the question. So a couple of pieces that are important to note. With our community surgical and diagnostic centres, we do have almost 900 operating in the province of Ontario, and we have a formula for compensating that is based on patients that are served. This is really about access and making sure that patients who are waiting for critical surgeries, as we've mentioned many times, cataract right now is the longest wait time, and those are people who can't be as active in their community, in their workforce, with their family as we want them to be, and they want to be. So this is about access and making sure they have expanded access. As you know, here in Windsor, Essex, already we have announced the expansion of the cataract license, which will mean that those individuals who have either had to wait or been paying privately are now going to be able to access that same service with their OHIP card. It's very exciting news, and it is really game-changing for the people who've been waiting too long, frankly, for these very important surgeries and procedures. Thank you.
Dave, do you want to give your perspective?
Yeah, so I know there's some out there, as the Premier indicated and Deputy Premier indicated, that are, quote, skeptical to the idea. You don't have to look far to see that it works. It works in Windsor, Essex. We've had it up and running for close to 3 years, where patients that need cataract services are available. We do 5,000 to 6,000 cataracts a year. If we didn't do what we did in 2020 with Dr. Tafor and Dr. Amara, that wait list would be 15,000 plus right now. Instead, it's 3 months or less to get your cataracts done. Are we working on getting that lower? Of course we are. But it's something that works. It works here in Windsor, Essex. Why does it work? Is we're closely collaborative and a cooperative relationship with the physicians. So the physicians, the ophthalmologists and anesthesiologists who work in that clinic also work in the hospital. They're required to. They want to, but also they're required to. So what does that do? The more complicated cases that cannot be seen at their clinic, they come and see them all hours of the day here at the hospital and perform the necessary surgery that's needed here at the hospital. It works. We've proven it works in Windsor, Essex. So we embrace this because we were applying every 6 months with Dr. Tafor and Dr. Amara to keep extending what we started in 2020. So now that this is going to be permanent, we just put in our permanent application actually on Monday, the day it was announced, to make this permanent in Windsor, Essex. So we're really excited about this, and also the possibilities of expanding it to lower acuity orthopedic procedures, etc. And that's what we're going to be working on next, pursuant to the 3-stage plan. But the fact that government said it's going to be done in a collaborative and cooperative relationship means we're not going to have these silos. We're going to be working together, and it's going to benefit the patients.
Thanks, David. That's what I was talking about, out-of-box thinker. He was doing it 3 years earlier than anyone else. That's the difference between David and some other folks throughout the province.
Hi, David. It's Dave Waddell from the Windsor Star.
Hi, Dave.
I was just wondering, how do you decide in making investments here in Windsor going forward, knowing that a new hospital is supposed to be in place in 2030?
Well, first I look at the quality of the people. You have some of the brightest and smartest people anywhere right here in Windsor, and especially when it comes to the automotive sector, it's huge for decades. You know, the automotive sector have kept Windsor moving forward, but there's so many spin-off jobs and tool and die makers and everything that goes along. They say there's about 7 to 1 spin-off jobs here in the Windsor area. But we're going to continue looking at expanding and offering companies around the world that want to open up in Ontario. There's still a tremendous amount of opportunities here in the Windsor-Essex area. Quality people are what makes companies go, makes communities go, and great leadership from the 4 people to the left of me here.
Actually, what I meant was, how do you decide to invest in the future in the hospital here, knowing that it's going to be replaced in about 8 years or 7 years?
Well, go ahead, Minister.
Yes, very specifically, the equipment and the investments that we are making today will be transferred over to the new Windsor-Essex Hospital. So what we are saying is, yes, you need, you deserve, you absolutely will get that new hospital. But in the meantime, there are things that we can do as a province to invest and make sure that your care increases in the interim. But to be very clear, the equipment that is happening and being announced today will be transferred over to the new site. Thank you.
Hi, Rusty Thompson from AM 800. During
Hi,
the
Rusty.
pandemic, you provided incentives and funding to attract and retain nurses, especially those in high-demand positions. By opening this up across the country to bring healthcare professionals to Ontario, will there be funding or incentives tied to that as part of the encouragement? Come work in Ontario, come work in our hospitals.
Not right now. We still want to make sure that we fund the nurses and pay for their tuition if they work in a rural area. Love to do that with docs too, anyone within the healthcare system. But I also want to take a look at the foreign students that are coming here to study in medical schools and taking spots from our young people here that are going down to the Caribbean and going over to Ireland to get their medical degree. I have no problem students coming here and studying and becoming a doctor as long as they stay here. I don't want them taking a spot from a young Ontario student and learning here and by the way, being subsidized to a certain degree too, and then flying back to their country. I want our students to be learning here and become doctors right here in Ontario.
Do you have a target for how many health professionals you'd like to see moving from across the country into the province?
Well, we need as many people as possible. We're trying to recruit right around the world, but just a message to all Canadians. We have the greatest jurisdiction in the world to live and find a job and raise a family and become an entrepreneur as well. And we welcome you with open arms. You won't have to go through any bureaucratic red tape. You arrive here with your credentials. We'll find a job immediately for you, and you'll have a great lifestyle when you arrive here in Ontario, the best place in the world to live, bar none, over anywhere.
This will be the last question.
Hello, Premier. John Lidke, Rose City Politics.
Hi.
You've referred to some of the skeptics and naysayers about expanding the role of private clinics, saying that Windsor is an example of where it works. You've also said, though, that our healthcare system is comparable, or you had a conversation with an executive saying it's comparable to North Korea or Cuba.
Yeah.
So I wonder, my question would be, do you think that you're going far enough to fix what you're seeing as the problems that we have?
I always look, and I just want to say I quoted someone that told me that. And I believe we still have an incredible healthcare system, but it needs to be tweaked. When something's broken, you just don't put the blinders on and not have the political will to do something. we're moving forward on making sure that we improve healthcare. I'm a strong believer in continuous improvement right across the board, no matter if it's continuous improvement in building new hospitals, with technology now is changing constantly, making sure we keep up with the technology, and most important are the people, making sure that we're training new doctors and as well as new nurses. We have 30,000 nurses at colleges and universities to fill positions, and we've hired so far since 2018 when I was first elected, 8,000 doctors as well. So we're doing everything we can, but I never make a change without consulting with the people in the healthcare sector, with great CEOs like David and other CEOs across the province there. But you know something? We're going to continue improving healthcare. I want the best healthcare system in the world. We're the envy of the world. That's what I want to be when it comes to delivering healthcare in a rapid fashion, professional fashion.
That's all. Thanks, everyone.
Thanks, everyone. Great to be here in Windsor once again.